President of the Jamaica Medical Doctors Association, Dr. Minzy Fitzhenley, says progress is being made in addressing issues raised by medical doctors at the University Hospital of the West Indies. Meanwhile, President of the Medical Association of Jamaica, Dr. Andrew Manning, has put forward a proposal as a short-term measure given the COVID-19 spike. Shamela Pullen reports.
The complaints came to public attention on Thursday. Among them were concerns about the exhaustion faced by doctors, particularly since the increased cases of COVID-19. President of the Jamaica Medical Doctors Association, JMDA, Dr. Minzy Fitzhenley, says the matter has since been investigated and the claims were true. Dr. Fitzhenley said several meetings have been held between the COVID team and representatives at the University Hospital of the West Indies, UA, to include the Chief Executive Officer, Kevin Allen, and Medical Chief of Staff, Dr. Carl Bruce. But the JMDA president says not all the issues were addressed. However, there has been progress.
So Ministry of Health and Wellness as well as UAE has identified 3 persons that are coming, one to start September 1 mid-September, one in mid-October. As you can imagine, that is far below what is needed because at least 10 to 15 persons are needed immediately to try and bolster the system. The hearing of only one person is clearly not ideal. So what we have done is that we've asked and put out a call to see if there's any additional persons that can start immediately to help with the team. They've also committed that they will discuss with the CMO and at the Ministry of Health and Wellness level to see if they can also identify any persons that can be added to the team.
Dr. Fitzhenley says discussions with the hospital officials are ongoing. She added that there will be follow-up meetings next week to assess the situation.
There is an official meeting again on Monday at, I believe, midday for us to discuss any changes that have occurred over the weekend and how the implementation has helped the system. But we are just stressing the fact that what we need is more staff and we need assistance on the ground. The way that the system is operating now, it is unsustainable and the doctors will not be able to continue working in these conditions.
Meanwhile, for the short and medium term, President of the Medical Association of Jamaica, Dr. Andrew Manning, is proposing that the authorities consider scaling back other services to assist with the COVID-19 spike.
Typically at the university, you have persons who are being managed on the ward. These are the inpatients, and you have outpatient clinics. Perhaps they need to scale back some of those clinics so the doctors who would be in the clinics now could perhaps, during that 8 to 4 shift, help with the running of the COVID ward. It's not something that I say lightly. We would generally want to avoid it. But we are now in extraordinary times. Perhaps they could do that for a short period of time.
Shamela Pullen, TVJ News.